for the young ophthalmologists who are the initial phase of their career and to share their problems and how to build up their practice and how to expand their horizons in the field of ophthalmology. And as you all know, Dr. Rakhi Cruz is the main brain behind this program, and she is the one who is coordinating uh, all the speakers and all the programs. And this program today we are having the part two of how you prepare for the FAICO examinations. As you all know, there are no guidelines or books to teach you how you prepare for this examination. And in this regard, we had the first part in the previous week, like on the retina, and today we have the second part on cataract. And all the panel and speakers who are here today are those who cleared this examination. And more than the books, they will share you how you can do better in this examination by their experiences, the books they referred, and how they appear for the practicals and the theory. With these few words, I welcome Dr. Prasanna Venkatesh. No need to introduce him. He is now one among our KSS family and
Thank you, sir.
rising young star.
Thank you, sir.
And Dr.
Aditya.
Aditya Varman. Good evening, Dr. Aditya Varman.
Good evening, sir. Pleasure to be here.
Yeah. And Dr. Shalu Chavan from Nagpur. And these are the external faculty who are with us today. And along with our KSOS faculty, I'm sure it will be a great program. And with these few words, I hand over the program to Dr. Rakhi. Over to you, Dr. Rakhi.
Thank you, sir. Good evening to everyone who has joined us today for today's KSOS York YOSI webinar, which is focusing on FAICO exams. So before we start, I would like to thank Dr. Bastin sir, our scientific committee chairman, all the governing council of Kerala Society of Ophthalmic Surgeons, and the governing members of YOSI for providing us with this platform for all the youngsters to teach, to learn, and to grow together. So this is the second of the series of FAICO exams. We had one episode initially, which was focusing on retina. So this one is on cataract. Similar to the previous episode, first we'll have a speaker who will be teaching us on how they prepared for their theory exam, along with experts who will also share their thoughts on how they prepared for their theory exams. And the second speaker will focus mainly on the practical part and some useful tips on how to face the practical exam. So today we have two speakers. The theory part will be covered by Dr. Veena Vishwam and the practical part by Dr. Prasanna Venkatesh. And the panelists, we have an expert set of panelists who all have cleared the FAICO exam. So they will also be sharing with us their own valuable tips as well as their practical experiences. So as we all know, these FAICO exams were initiated by AOS in the year 2010. And the main purpose was to update the knowledge of all the ophthalmologists as well as to improve the clinical practice patterns and to establish a uniform fellowship system across India. And unlike the other fellowship exams, which comes with hefty price tags, and this one is actually a little cheaper with a fees of only 10,000 rupees, and all the exam centers are at accessible areas. So I would like to request everybody, regardless of your age or experience, if you have a plan or if you are willing to take an exam, to take this exam to update your knowledge as well as to strengthen your CV. So we felt that this webinar is a need of our because this FAICO exams, actually many of us are unsure of what to learn for this exam and what to expect when you go for practicals for this FAICO exams. So keeping this in mind, we have crafted this series of webinars on each subspeciality. And so this is, so without much ado, I would like to hand over to my co-moderator today, which is Dr. Aparna Jayashankar. Dr. Aparna Jayashankar has done her DNB from Lotus Eye Hospital, Coimbatore, and she has done her fellowship in cataract from Ahalya Institute, Palakkad, currently working as a consultant ophthalmologist at Ahalya Eye Institute, Kottakkal, Malappuram. So she'll be co-moderating with me today. I'm happy to have her here. So she'll be introducing the panelists first and then the speakers, and then we can kickstart. I hope everybody who has joined us today will find this webinar very beneficial for the exam preparation. Over to you, Dr. Abarna.
Thank you, Dr. Rakhi, for the wonderful introduction. And without much ado, we can welcome our wonderful panelist. And we are incredibly fortunate to have with us today our panelist and 4 panelists and 2 speakers. And the names were already mentioned. And Rakhi ma'am, can you share the screen?
Yeah, 1 second. Is it visible?
Yes. First of all, I would like to welcome our wonderful panelist, Dr. Marin Paul ma'am. She has done her MBBS, MS Ophthalmology from MGIMS Vardha, Nagpur University, DNB, FAICO. And the fact of emphasis here is, Madam is the first ophthalmologist from Kerala to achieve FAICO in any subject. And currently, she's working as the medical director at Trinity Eye Hospital, Thrissur. And she runs her own clinic, Eye Care Center at Chembukava. And she's an active member in both state and national ophthalmologic societies. Welcome, ma'am. Welcome to the webinar. And to our next panelist, I'm very excited to welcome Dr. Aditya Joshi. He's a senior consultant ophthalmic surgeon, currently working at Amita Eye Care, Tiruvalla. And he's an experienced FAICO emulsification trainer as well. And sir has won awards for Best Video Presentation at Dr. Noel Moniz Memorial CME and 3rd prize award at NIO Pune Icon 2024. Welcome, sir. Welcome to the webinar. Next.
Thank you.
Next, I would like to introduce our next panelist, Dr. Aditya Varman, MBBS, MS, FWCRS, FAICO, Cataract and FAICO emulsification. And he's a cataract and refractive surgeon and head of FAICO training program at Uma Eye Clinic, Chennai. He's an executive member at UC. He has won quite a few awards and recipient of several best paper awards. And he has numerous publications as well. Welcome, sir. Welcome to the webinar.
Thank you.
Next, I would like to introduce Dr. Shalu Chavan. She has done her MBBS and MS Ophthalmology from BJ Medical College and SGS Pune. And she has FAICO at Cataract and FRCS. And she has just completed fellowship in Cataract and Refractive Surgery from Narayana Nethralaya, Bangalore. And she has also done a short-term fellowship in medical retina from HV Desai Eye Hospital, Pune. Happy to have you here, Dr. Shalu. Welcome to the webinar. And I take this opportunity to thank each one of you for making time among your busy schedule to attend this webinar. Welcome to the webinar, all the panelists. And without further ado, we can kickstart our session. And we have our wonderful speakers, Dr. Veena Vishwam and Dr. Prasanna Venkatesh Ramesh for the sessions. First, I would like to welcome Dr. Veena Vishwam. She's a glaucoma consultant and cataract surgeon, medical superintendent at Amardeep Eye Care, Trivandrum, past joint secretary of Trivandrum Ophthalmic Club. And she has FAICO in both glaucoma and cataract subspecialty. Over to you, ma'am.
Thank you. Can I start?
Yeah, you can share your
sure, ma'am.
Is it visible?
Yes, ma'am.
Okay. First of all, I thank KSOS and UC for giving me this opportunity. I'll be presenting how to prepare for FAICO theory exam in cataract and FAICO emulsification. As we all know, FAICO exam consists of theory part and an OSCE and Viva. OSCE and Viva usually will be on the same day. So I'll be dealing with the theory part and the different specialities of FAICO and the necessary subjects and all already have it was covered in the retina session last time, and it is available in the website as well. I am not going into the details of exam centers and all those things. I'll be covering cataract and FAICO in detail. So as we all know, the exam pattern in theory exam is MCQs, and there are 100 questions, and you the MCQs, we have to attend 100 questions in 2 hours. So approximately you'll be getting 1 minute and a few seconds for each question. And most of the questions require that much time. And there are no negative markings, and the cutoff for passing the exam is 70%. You have to get a 70% mark to pass the examination theory. Then a detailed revised curriculum for each specialty is available in the AIOS website, and you can go through that. Especially in cataract, it is given in a very detailed, exhaustive list of topics are given. So regarding my preparation, my major books of reference were these. We have to know everything in American Academy of Ophthalmology book, everything in Lens and Cataract, the latest edition. Then Kansky, the chapters on cataract is not very big, but still I went through the latest Kansky as well as the 9th edition. And in American Academy of Ophthalmology book, there are some MCQs as well at the end of the text, which will be very much beneficial for the exam. So I'll just brush through the important topics which you should be knowing in cataract regarding theory exam. So regarding anatomy, physiology, and everything, especially in anatomy, all the numbers are very important. So parameters at birth, adult size, thickness, all such thing, weight of the lens. Then the examiner seems to be very interested in the capsule details as well, thickness of the capsule, the sutures, Y sutures, then spaces behind the lens, zonules, accommodation, and ciliary muscles are another area of interest. Then biochemistry, though exhaustive, we have to study in detail, especially all the proteins of the lens, then the channels, water channels, and sodium chloride channels, as well as the potassium channels, all such things. Whatever is given in the AO textbook, we have to be thorough with. Then physiology, though exhaustive, you have to make notes and write down main pathways and study in detail. Once you have studied it, all these things become easy, and when you are working MCQs, it becomes easy for you to pass through. Then embryology, only a few pages are there, but you have to know the timeline when the lens, each part of the lens develops, and from where it develops, all the chronological order of events which happens in the embryo, you should be thorough with. Now, coming to the syndromes and in congenital cataract, you have to know everything like related to that, like genetics, then systemic associations and other ocular associations which may happen with these sort of conditions. So a lot of questions come from Lowe syndrome, Peters syndrome, all such conditions. Then coming to lens pathology, drugs which cause cataract are all important. Trauma-related cataract is also important. Then metabolic disorders like galactosemia, hypocalcemia, myotonic dystrophy and all, you get a lot of questions. Enzymes and different types of these metabolic disorders are all very key points which you should be thorough with. Then epidemiology, only few things are there in like you should be thorough with. Then studies, important studies like endophthalmitis vitrectomy study, then Haripriya's moxifloxacin study. All such studies, usually the important points should be read and be clear. Then in cataract evaluation, the most important thing which I noted, the most of the questions we got were from biometry and optical biometry as well as ultrasound biometry. Lot of questions were there, and the comparison which one is better. Then special situations like in silicone oil eyes, how will be the velocity and what will be the difference in higher axial lengths, lower axial lengths. All such questions are very important. Then IOL calculation formulae. I accidentally came across this book from which I got from AIOS, which was by Professor Rajesh, and it was having a lot of important formulae and points which were very much useful for me in my exam. I got many of the questions which were asked were there in this book. Actually, this is a very nice book to go through. I would suggest you to read this. Then preoperative preparation, anesthesia, sterilization of OT patients, then drugs like dilating drops, intracameral medications, all the contents, percentages, dilution, dosage, everything is important. All the contents of whatever drugs you use in OT you should be thorough with. And in cataract surgery, the procedure of ECC, SICS, FAICO emulsification, and such all surgical procedures you should be thorough, because especially if you are an operating surgeon, you will be able to answer the questions much better. Then OVDs, OVDs, all those soft-shell technique, all those things are also usually asked. Then IOL types, newer IOLs, secondary IOLs. I even got a question from about piggyback IOLs. Then astigmatism correction, aberrations. Then all these newer IOLs like toric IOLs, multifocals, aberration related questions are all very common. Then FAICO emulsification is a very interested, usually usually FAICO emulsification questions are very common. So you should know the fluidics, the instrumentation, the procedure, the newer advances in FAICO emulsification, and latest all advances, including flags, are also so many questions usually come from all these topics. Then complications related to FAICO like PCR, floppy iris, vitrectomy, how you manage these conditions. Then post-operative, immediate post-op, long-term post-op, and endophthalmitis is another important point usually asked. So astigmatism, post-op astigmatism, also how you manage. All these things you should be knowing thoroughly. Then special situations in cataract surgery, like cataract surgery after refractive corrections, the IOL power calculation. Then in pediatric cataract surgery, how you calculate the IOL power and what all things you should be careful about. Then extremes of axial length, nanophthalmos and high myopia, all such things, as well as in silicone oil filled eyes, what all you will come across are also usually asked. So in MCQ preparation, I would suggest a few tips. When you study, you note down the points as MCQs, because once you start revising, you can use it as mock questions. So it will be easier for you to attempt your MCQs if you are noting points as MCQs and studying that later. Then references for collecting MCQs, AAO One Network has a lot of MCQs. Then there is a paid channel called Ophtho MCQs. You can share it with your friends and get questions and share the questions among your friends if you're doing like that. Then AO basic sciences, behind the textbook, there will be around 25 to 30 questions, MCQ questions. You can collect the previous editions also, and some of the questions will be different. So such questions from 2-3 previous editions you can collect and practice them. Then FRCS Part 2 Cataract also, some questions are there which will be useful for the exam. So collect all those questions and repeatedly do those MCQs, because repeated revision is necessary to to remember all these things. Then mock exams, do mock exams, because time is also very important. So 100 questions in 2 hours. So do mock exams of collect questions, and whenever possible, write and see whether you are able to complete it in 2 hours. Then another thing is, if you can identify seniors and colleagues who are interested in similar subjects, discuss these questions with your seniors and surgeons who are doing cataract and practicing such things. Then this is actually a boon for ophthalmologists. The iFocus online website, in YouTube, these videos are available. You have the best of the speakers, and the panelists will also be very good. So the discussion part, you get a lot of points from this. You can actually, when you are in the OPD in between patients, or when you are having time, you can just switch it on and hear it. Even while at home, while exercising or something, you can keep on hearing it. And around 60 lectures, more than 60 lectures on cataract are there, and all are very important topics. Latest topics are also coming. So this is a must. iFocus online is a must for preparation of this exam. You have to repeatedly hear it and note down the points and study. Then there are other YouTube videos by like Deepak Megor sir's video, then cataract coach videos on many important topics like IFIS and nanophthalmos. Then this master stroke by one talk by Minumathan sir was very useful for me. Then Professor Venkatesh and Suvira, many topics, especially the decimal membrane problems, all those were very much useful for me for my exam. So I'll tell you, the type of questions are not usually straightforward. It may be tricky. Usually I have an example of a tricky question. This is like, what adjustment in IOL power needs to be made if a plant in the bag IOL is put in the sulcus with optic capture. So if you are not reading the question carefully, you may just in a hurry you may just think till the sulcus. You may skip the optic capture part of it. So you may write or decrease the power of IOL as the IOL is coming in the sulcus. So with optic capture, there is no change in the power of IOL. Only if you read the question carefully till the end and concentrate, you'll be able to answer such questions. This is another one. This is a simple question actually, but you have to read even the choices to answer the question. Like during FAICO emulsification, surgeon notes loss of anterior chamber depth. The eye becomes firm and the patient reports feeling pain. Now you know that this is suprachoroidal hemorrhage. Then what should the surgeon do next? So then you have to read carefully all the choices and see which is the best choice. So such questions are usually asked. So more than 1 minute may be required in many of the questions. So practice questions, answering questions, and then only you'll be able to brush through the theory part. So to conclude, I would say develop a passion for learning, and if you do, you will never cease to grow. Thank you.
Thanks a lot, ma'am. That was a very good presentation. And I think she has covered almost everything. We'll just go to the discussion of the theory part. Marin, ma'am, so how was your preparation for the theory, and was there something different, any key points?
No, I think she has done really very well covered all the points, because I gave the exam actually the theory in 2012. That is just 2 years after it started. 2010 they started, 2012 I gave the exam, the theory. And at that time, of course, all these other online resources were not there. But that time, what was working best for me was, of course, the AAO, the book. Most of the, actually, I think around 70% of the questions will come from that textbook only.
Yes.
And Kansky, and even that that time there was that Yanov book was there. Yanov.
Yeah.
So that is the 3 books which I used to prepare. And but actually at that time there was no, like, the syllabus and all was not there. So now things are much more, there's much more clarity on these things, what will be coming, and so the questions were also like, totally like mostly focused on she said, on figures. So they will put like, the thickness of the capsule at the thinnest point is this kind of actually practical questions were not so many in the MCQs at that time. I don't know what is happening now, but it was mostly tricky questions to make you confused. So my advice would be that you need to be extremely, like, you need to really mug up all these figures and values to get through that, to get to that 70%. That is very, very important, because they'll put, and also like, combinations of OVD, like what is the percentage of chondroitin sulfate, what is the percentage of sodium hyaluronate in this particular combination. So these kind of questions are very, very common. And so your facts have to be like on point. That is my take on this. Otherwise, Veena, you did a fantastic job.
Thank you, ma'am. Thank you.
Dr. Aditya, anything to add on?
Yeah. So for me, my preparation was just like how Dr. Veena said. I relied on AAO. So AAO covers most of it. The volatile subjects like embryology and all, I would say you keep it towards the end because you may read it and then it'll evaporate. So I only read embryology about 2 days before the exam, and I was able to answer most of the embryology questions. iFocus was a fantastic resource because those videos, they cover everything in excruciating detail. So each topic in the iFocus videos on cataract was about 45 minutes long. So if you can just keep listening to that casually also, you'll pick up on a lot of recent advancements and all of that. One of the most heavy topics that was asked in the theory exam was on biometry. So there were a lot of questions on biometry, especially on post-refractive calculations. So I think you really need to be very thorough on biometry, including the latest formula. It's not enough if you just know SRKT and Barrett and all. There are a lot of new formulas that have come, including the AI formulas, and they are even asking which one is more accurate. So you have to be able to answer those. That can only be answered if you go through journals. And another resource for me was in the ASCRS meeting videos, because in both in ASCRS and EACRS is where all the recent advancements are first showcased. So if you have attended those meetings recently, the last 1 or 2 years, if you go through those videos on biometry, IOL choices, that will really help you a lot. Or if you've not attended, please ask a good friend of yours who's attended to share the credentials, and you can go through the videos. So a lot of those biometric questions I was able to answer because I watched those videos from ASCRS, which had all of the recent advancements. So I think in most of the people I've spoken to about FAICO, they say one step is difficult, the other one is easy. I think for our batch, the theory was more difficult. I think about 50% able to pass theory, but everyone who passed theory all cleared the practicals. So I think either one step is difficult, but once you get through, the other one is relatively smoother to take.
Thank you. One doubt I would like to ask, among these different IOL formulas, the latest ones, there are so many parameters which are included in the formulas. So will they ask deep into those, what is there and difference which is not there and all?
I think we see, thankfully not most of the time. Most of the questions which were related to biometry were more on application. Like, for example, if this patient had a hyperopic LASIK, how would you go ahead and do the calculation and whatnot was there? There was one very ridiculous question on what the Sharma's formula was, which is a post-refractive formula, which is totally outdated. They actually wrote 4 different versions of this formula and asked you to pick the correct one. So that even if you read 10 times, you probably will mess up on the MCQ. So you will have those questions in which you are supposed to get wrong and are very difficult. I don't think you should really fix on that. I think at least 60% were very answerable, and about 20% was somewhat here, there, and 10% were really tough. The happy thing is about maybe I would say 30 to 40 questions were questions in which you could answer if you're an operating phaco surgeon.
Yes.
Right? If you're doing surgery on a regular basis, you will know what the answer is. For example, they'll ask you, what is the, one of the questions was, what is the preferred choice if you have IFIS? Will it be hooks or rings? So those very practical stuff. How will you decompress and intubate and cataract?
Okay.
Those questions you can very easily answer if you're an operating surgeon.
Okay. Dr. Aditya, anything to add on to the theory preparation part?
Yeah, actually, I also used all the same books what Dr. Veena has mentioned already. To add on, maybe I would say all of us may not do pediatric cataract so frequently. So probably those IOL power calculation formulas and all, because we also had a question on pediatric IOL power calculation, and the choices were very close in specifically in that question. So if we don't know the formula correctly, probably it might go wrong in such cases. Even a few other things like I thought of like the time for the exam as such is, as we know now, it's 2 hours and 100 marks. So many of the questions are straightforward. But few will have very tricky similar answers where we need to give some time. We can always flag them and finish off the easier ones first, and we will get some time definitely at the end to go through the questions again, and probably it will be easier to crack those questions at the end.
Okay. Thank you, Dr. Shalu. Dr. Shalu was a gold medalist for the FAICO exam. So would you like to add something more?
So I think almost everything is covered by now, but just few more topics I would like to add are the recent intraocular lenses, the EDOF ones, the multifocal ones. They're very trendy, new ones keep coming into the market, So those also I think the students need to be aware of. Beautiful articles are available online, which help to know the lenses, especially the manufacturing part, their refractive indices, how they work, how they're different from the previous ones. Those also they ask sometimes in the recent advances. Also, another topic which really helps in theory as well as practicals is phaco-dynamics. Very basic, but even that needs to be covered. You have to be like thorough with it. You have to be phaco-dynamics essentially has to be on the tip of your tongue. Ask you anything related to it, even in the practical exams. And third topic, I think, which also needs a little bit of attention, I think, which Dr. Veena has already got. Optics also is one of the topic which should be, you can just, brush it up. The type of lenses, for example, 90D lens, 20D lens, how they work, and the optics of intraocular lenses as well. And the post-refractive calculation part is also very important. The calculators which are used for that. So the type of questions asked over these post-refractive calculators is, for example, there was one question which was asked in OSCE, as in there was a post-RK picture which was given, on the screen. It was given on the screen, and patient details were given, and the patient had some refractive surprise. So the question asked was, what could be the reason of refractive surprise? So it's very important to know that how post-RK cuts are, how many they are, how you have to include it in the calculator. So these things are a little new, which are not covered in the textbooks. I feel we need to be little aware of those things, and of course the complicated cataracts and the management. So those things also should be given a look and read thoroughly. I think the rest everything else has been covered perfectly.
Okay, so I think now we'll move on to the next part, which is the practical part, and then we'll continue the discussion. Dr. Aparna.
Screen.
Yeah, just share the screen again.
Now we can move on to our next session, the practical part. And with great pleasure, I would like to introduce our next speaker, Dr. Prasanna Venkatesh Ramesh, MBBS, MS Gold Medalist, DNB, MNAMS, FAICO Glaucoma, FAICO Cataract Gold Medalist. And Research Director and Head at Mahatma Eye Hospital, Trichy. And he's currently Joint Secretary to YOSI and Editor-in-Chief of the book titled Oculus Res Gestae, Editor, Board Member of IJO, Editor-in-Chief, TNOA Journal for Ophthalmic Sciences and Research, and Management Committee Member and Chief Instructor in ASCRS, WGC, APAO, IARC, AAOs, and he has won many prestigious awards. Over to you, sir.
Thank you, ma'am, for the sweet introduction. Thank you, Raki, and Yoke team, YOSI team, for giving me this opportunity to be here. I think we have had a great discussion on how to go about it. I'll just try to share my 2 cents on how I made it. Hope my slide is visible, Raki.
Yes, yes.
Yeah, thank you. So how I made it with a more practical touch, and we can also have discussions at the end. So thank you, KSOS. It's just been 10 days or 2 weeks back. I was there at Tiruvalla, and thank you for having me. The Sub-Inspector Bharathan Dosa I ate is still very fresh in my mind, and it was one of my favorites. So thank you for having me once again here. Within less than 2 weeks, I really enjoy the vibe of Kerala. So here we are, FAICO demystified. And so I am grateful to be, in the 2 flyers of FAICO that you guys are seeing. As Raki told, if you are seeing this flyer in your mails, the members who are seeing it, do apply it now. And it is one of the most prestigious exams. Start now. And you may get to feature it like how I get to feature it here. You never know. So why FAICO? It's an additional credential, excellence, credibility it builds, gives you recognition, and opens up opportunities. Yes, you have to be an AO's member. That is a very, very important part. And you have to complete your DO, DNB, MD, or MS with any recognized qualification. That is most important by India. And this is a very important part. You need to have 2 years of experience, including the time spent in senior residentship. That's what the guidelines say. And you have to have completed your subspecialty fellowship for at least 18 months. So these are some of the guidelines that is there, and you have to complete your senior residentship as well. So senior residentship or your fellowship, we can complement it both ways around. It's available as of now. You can see I've given the reference August 12, 2025, retrieved from the AO's website. And as the previous speaker said, if you are a practical surgeon, the guidelines say 3 years of practical work. If you are a practical surgeon, it really makes a lot of difference, which I will be sharing it to you in the subsequent slides. Because practicals, they would just evaluate whether you know to operate, and these are some of the scenarios which will be bombarded on you. And the examination centers online. Return centers are online, and you have 6 or sometimes even 8 centers. And OSCE and Viva, different centers will be rotated. So I was lucky to have a CFS in New Delhi, and some of my examiners were Maipal Sachdev sir and few other stalwarts in ophthalmology. I still remember it very vividly. Last year was when I finished my FAICO in FAICO emulsification. The examination fees is 10,000. And the DD has to be taken as what was well covered by previous people. And these are the 2 stages which are very important, which I'll be covering. Of course, the theory, you need to clear your theory, then only you will get eligibility for OSCE and Viva OC. And in case if you clear your theory and you miss out on your practicals, you don't need to go back to your theory. You can come back to the practicals for the next year. And there is no negative marking. So I have shared some of my previous emails. Thanks to Raki, I went back to some previous emails. It gave me a nostalgic feeling. So I cleared my glaucoma in 2019 batch. That is in 2020, I wrote my glaucoma practicals. So this is how you will get a mail once you pass your theory. You will be very happy for a short while, and then you will feel the butterflies, because after you finish your MS, one thing you would have thought is I would never go to a Viva. But again, here you are, you have to go back to a Viva and again sit in an exam environment, and you'll have to get your Viva kit ready. So Viva doesn't involve only Viva, you'll have OSCE as well. And after you finish your theory, which has been well covered, the OSCE is the second stage, and we had around 10 OSCEs where in 2020, when I cleared my glaucoma FAICO, we had a standard moving OSCE. We had to move from one station to another for 10 rings of the bell, and we had 2 break stations in between, if I vividly remember 5 years back. And in 2024, January, when I cleared my FAICO emulsification, it was totally different. We didn't move. We all sat in a U-shaped bench, and the digital screen kept on changing, question 1, question 2, question 3. And there were many sub questions. Each question had 3, 4 questions. So even if you didn't know one question, you also had an opportunity to, at least write second or third. We had a congenital cataract question. We had an aniridia patient, and we had an aniridic implant of how you will go about it. We had a CTS implant. We had a subluxated IOL. So these were some of the images that I can vividly remember in our OSCE. And once you get, even if you are not able to get the diagnosis of the image, you are able to answer 3 or 4 as well. That's how they framed the question. It was not that difficult. And then comes the Viva. So once the OSCE is done and dusted, you will go to the Viva, and these will be the 4 stations. One will be the drug investigation and instrumentation. And the other one will be the implant or device that you use in surgery. Third would be a surgical clip. We had more of images at CFS New Delhi. And again, the other one would be a pathological specimen. Again, that could also be a slide or an image. So the marks allocation, the formative assessment, what the syllabus in FAICO says is they have a logbook evaluation, but I don't think that was strictly followed. Clinical and theory exam will be there along with the rubrics-based skill evaluation are some of the syllabus that they say, but that's not how it works. What happened is you'll have an OSCE station, as I told, we had around for 100 marks, we had OSCE stations. After you finish your OSCE for 100 marks, it depends on 10 or 20 on how your rubrics are divided. And once that is finished, you'll go to your Viva OC. Viva OC, what I can remember was 4 stations of Viva OC. And that is where they finish off the complete evaluation. The logbook or the formative assessment, which the syllabus says in the website, was not discussed detailedly for at least our batch. Applying online is what you need to, go and start your link, or even go to the website and see the guidelines. There is a syllabus that is available, and this was one of my own screenshots which I have archived. And thanks to Raki, I was able to bring out everything. Filling in the forms, and those are all some important steps which is very important when you start your journey for your theory exam. And these are some of the important brackets that I wanted to convey. And now there is a revised curriculum that I wanted to share, especially the revised curriculum for subspeciality. If you go to the website, it is a PDF. You can just click and download, because the curriculum is what we need to study. Of course, we do discuss with our previous predecessors what happened, what was the question, but AOS has come up with a beautiful revised curriculum PDF. And to just add on to the previous tools, I'm just not to overlay. AAO as one access network. eOphtha was another one that I found it very useful. Ophtho questions, ICO previous exam questions from Telegram was very useful. PubMed and DJO, Digital Journal of Ophthalmology. And I subscribe for iDocs, a paid version. And I do have those content in PDF with me. If any of the attendees want the PDF file, do ping me. I'm happy to share it to you guys. Because I felt iDocs was very, very useful. iDocs and Ophtho questions, along with the ICO previous exam questions. Important topics are, as my good friend Aditya told, biometry, aberrometer, corneal topography, and another good friend, Dr. Zain, told me to study about eye trace and go. I didn't have eye trace at my center, but in practicals, I was asked about eye trace. Again, no financial disclosures, but these are some of the questions that are asked. And as the previous gold medalist or the current gold medalist beautifully told regarding FAICO dynamics, that is something they will grill you left, right, and center, because pump mechanism, FAICO tip designs, fluidics, FAICO power modulations. So these are the simple things that you would be expected to answer. And IOLs, again, some of the discussants told monofocals. I was asked on monofocal plus diffractive optics, EDOF lenses, toric IOL, simple concepts of simple, what is the optics of it, or simple discussions may start with these. What is the principle of these lenses? Very basic questions. And choppers, you may ask questions on choppers and special devices. One of the OSCE sections I was asked about CTS, and I was also asked about capsular hooks versus iris hooks. So they gave me two of these hooks and told me to differentiate. So if you are operating those things, it will be very easy. Some of the theory topics are important and it may cross-pollinate here also, where subluxated cataract, types of syndromes, cataract with different syndromes, a perfect OSCE question, drugs inducing cataract, again an OSCE question, pediatric cataract with syndromes, that is also an OSCE question, which will come. And as Dr. Aditya told, these are some things you keep it last. It's very volatile, especially when you don't get to practice much embryology, and I don't do much of pediatric cataract. So these are something that you need to keep it to the last to read. And a few important topics again of late are striate keratopathy also can be given as an OSCE question. TAS, endophthalmitis, differentiating table. Endophthalmitis is very important because they will evaluate in practicals whether you know to handle endophthalmitis and whether you know to differentiate between TAS and endophthalmitis. And intraoperative, two complications which in practicals the examiners would like to know how you handle this: PCR with vitreous loss, PCR without vitreous loss, and similarly zonular dialysis, how do you manage? So these are some of the things they want to see how you go about it. These are some of the things in the syllabus that mentions. I'm not very practical about it. I feel you need to have a hands-on on this. You need to know how to do it. YAG capsulotomy, YAG cap is something will be asked. SACS, phacoemulsification, biometry, A-scan, foldable lens also you should know something about it and what's currently brewing in the market. And so my journey, I was more focusing on glaucoma, and I attempted glaucoma in 2019, and luckily I cleared glaucoma in the year 2020. In Gurugram, I convocated, and those were times I felt the theory was very tough those times. We had only 60 questions in theory. I think the curriculum changed in 2024 with 100 questions. Because those journey theory was very tough. Theory was all, as one of the senior ophthalmologists were telling, Dr. Merin ma'am was telling, I felt theory was very tough because a lot of percentage questions, a lot of personality questions were asked, even in glaucoma at that time. So gradually, you can get 2 FAICOs. That's what the guidelines say, according to my knowledge. So I started preparing for FAICO as well, being an academic nerd. And you doing a lot of combined surgeries. And just a second, I just lost my slide there. So, me being a combined surgeon, you would want to refine your skills. So these are some of my combined surgeries, which I do day in and day out, and you end up with complications. So this was a PC rent that I had. And, I'm not going into the detail of it, but you manage these things day in and day out. And I attempted my FAICO cataract in 2021. My first attempt theory, I failed. I had 60 questions. I still remember the questions. Who innovated vertical chop, horizontal chop, stop and chop, multi-layered chop? 4 questions were there like this. What was the percentage of cataract and Down syndrome? What is the amount of hydrophilic content? So many percentage questions. I was not prepared. I failed. But you keep operating, right? So I keep operating. We keep publishing, and this was one of donut capsular access technique, which we published along with Dr. Praveen from Srivilliputtur. I learned this technique from him, how you manage Argentinian flag sign very effectively with the small rexes. And you keep doing what you're doing because it's day in and day out. You don't, exams doesn't stop you. So this was a technique where I learned from him, and your skills keep developing. And I did my second attempt of theory in December 2022, and I failed again. So again, I studied all the previous year exam questions and went, but again, it was a googly question. So we were asked about a lot of new pupil expanders, those expanders which I never even heard of. And 10 questions came like that. And again, we had one of the questions called FAICO pinch test. What is FAICO pinch test? I don't know whether if you guys know it. I didn't know it at that time. So FAICO pinch test was one of the tests which I came out and I read, you really take the FAICO probe and you pinch it in your fingers to check the power. So, I mean, these were some of the questions I totally resonated with senior ophthalmologist Marine Paul ma'am when she told in 2022 also there were only 60 questions, 2 hours. So the curriculum changed in 2024 because I was continuously attempting. And this was one of my cases which I operated in 2023. I did everything for this patient. It was a zonular dehiscence case. I used CTS, I used a CTR, I used capsular hooks, and so you keep evolving as a surgeon and you keep managing vitrectomy settings, CTS, and it was a toric patient. And I did a pars plana route technique. One of my publications where I hooked the CTS using a Prolin. I bagged the suture. I used a 50 Prolin suture and used the CTS to hang it with a 50 Prolin suture after a zonular dehiscence. So you keep improving with day in and day out. And in 2023, when I attempted for my third attempt, I qualified successfully for my theory because I felt there was a huge change in the syllabus also. The paper was also easy. I would not say otherwise. And 2021 and 2022 was tough. The pass percentage was only 1 or 2 candidates. I think 1 year there was no candidate, 1 year, one candidate pass. And in 2024, January, I went for practicals and I got my FICO. And I think I just wanted to share my failures as well. I failed 2 times before I got my gold medal in FAICO. I think if it's meant for you, it will come to you. And I was the topper of my batch after two unsuccessful attempts, thrice lucky. Among 34 batchmates who cleared, I was the topper. Like I think one of the previous discussants commented, I think Raki told she topped in 2025 and I graduated in 2024 when the gold medals were introduced. So this was
gold medal for
this was
cataract
one
and
of
FAICO.
my very fond memories of Dr. Santosh Anavar sir. I feel it's a
Cataract
moment
FAICO
which really
for this
we as an academic person,
Ramesh.
we really earned for, and these are some of the things that I have it in my archive where we walk the podium
While Prasanna gets it, all of you please come up.
to get the medal. And
We have one more
then we
left.
have the group photo with the AOs presidents
From
and the
Prasad Netralaya,
governing council
Udupi.
members. So yeah, this is what we do. And now I am here. I have launched my own FAICO training module at my center. And I'm on the other end training people at my center. And to conclude, FICO is a prestigious subspecialty. It really puts you well on the international forum, especially when you're applying for international ICs. Your CV matters. Even in AOs, if you apply for an IC, your CV matters. So build your CV. And your eligibility is your PG qualification with your fellowship. 3 stages of exam. 2 is practicals, which happens on the same day. There are formative and summative evaluations. And preparation is key theory, facts, and you need to be an operating surgeon to easily clear your practicals. That alone is enough. Easily you'll walk through your practicals. I feel theory is the most tougher part. That is where I stumbled 2 times. Diagnostic surgical techniques, complication management. If you are through, I think your practicals will be a cakewalk. And if any of the members, as Raki told, thank you once again, Raki and KSOS, for inviting me here. Just apply. You will be finding it in your box. I think the date is still not over. I think you can apply still for your FICO exam. And if you want the books that you have to One Axis Network, previous question papers, and the ICO previous exam questions, along with the iDocs, you don't need to subscribe. Just ping me a mail or on Insta or WhatsApp. I'll send you my archive to you. And you don't need to have the pain of subscribing. I'll get it to you. Thank you, KSOS, for the wonderful opportunity to share my journey and 2 cents. It was very nostalgic for me to share it. Thank you.
Thank you, Dr. Prasanna. I think he has also covered it elaborately. So now we'll move on to the discussion. Dr. Aditya, your experience on the practical exam.
Yeah, okay. So I'll just give you some practical tips. So it's basically an OSCE game, right? So you have 20 stations, and the unfortunate part is you have very little time to actually examine the patient. So we had patients lined up in each station, and we had to examine and write the questions that were asked. So the thing is, just take the time and see the patient. Most of the time, it's not too complicated, right? And don't spend too much time answering the questions very elaborately. You don't have to answer it very elaborately. You just have to answer it in just points, because if you start writing a long essay, you won't finish on time, and then the next station starts immediately. And then you'll miss out, and it keeps carrying over. It's like a domino effect. Then you won't have time to finish it all. So write just highlights, just point by point. That's more than enough. They're not going to see it. They just want to know if you've identified it correctly, right? And the other thing is, don't overthink, because I remember, I think one of the first stations I went to was a case of pseudo exfoliation, and they asked a few questions regarding that, how you will manage it. I written that, and then the third or fourth station was again pseudo exfoliation. So I spent and I wasted time examining it again and again and trying to see if there's anything else that I missed out. And turns out there were two cases of PXF. Basically, the reason being, the fellows and the over there only coordinate the cases, and probably they didn't get more cases. They put two PXF cases and they confused us. Right. So don't overthink it. Other thing is, see which center you're going to, and once you know where your center is, spend some time to find out what that center is famous for, and you go back and read all the publications from there which are relevant to the subspecialty. So we were put in Agarwal's, and if you put in Agarwal's, you know for sure there's going to be one question on glue dye oil. 100%, there's no doubt about it, right? So the moment I saw a patient with a three-piece IOL, I looked in the side, and of course there were two steel flaps. So the moment I saw the flaps, I know this is glue IOL, and I wrote everything about it. I also watched some videos on glue IOL before I went to the exam, even though I've never done a glue IOL, because I know it's going to come. Right, and then I spoke to a few people outside, and they did not notice the scleral flaps, and they're written as a sulcus IOL or something. So if you go prepared beforehand and you know what that center is famous for, you will know what questions are possibly going to come. And there was one more patient who had a pupilloplasty, the fourth row pupilloplasty. So I knew that these things were going to come because it's at the center is famous for it. So you can do your research, you can work backwards and get it done. The questions per se in the OSCE are quite simple. You just have to identify, and if you're a practicing surgeon, at least 90% of the cases you will identify correctly. So there's no issue about that. The other thing is, with regards to the instruments, like what Prasanna said, they'll ask you on aberrometers and all. There was questions on eye trace. So the thing, luckily, I have access to eye trace, but people who do not, just spend the time to look into the instrument brochure. That's more than enough. If you look into the instrument brochure, you'll understand. So, for example, in the eye trace, the photo, it showed aberrations. It showed that the lens aberrations were high. That is, it had lenticular astigmatism, but the corneal astigmatism was nothing. And the question was, would you implant a toric IOL? But most people didn't see whether it was lenticular or cornea, and they wrote yes. So if you're not very familiar, you won't know it. And you have to be familiar with other biometers also, like other, so even if you don't have it. There were some questions on Argos and all that. And I don't have Argos, but I went through some brochures in it. I was able to answer the question. So you have to be quite thorough with the latest equipment, latest technology. Even if you don't have it, try to look online. There's a lot of resources that will familiarize you with the instrumentation that they'll ask you with. The only thing I struggled in practicals was with the drugs, with the medications. So I was able to answer most of it, but very embarrassingly, when the examiner asked me about the mode of action of this drug and that drug, I kind of stumbled because my basic sciences was 4-5 years ago in PG, and I forgot everything about it. Other than that, everything else was smooth. So probably go back to your basic sciences, read about the mode of action of these drugs. Even though it's very basic, sometimes on the spot, if you're not very familiar, you can't recollect. But otherwise, it's quite simple.
So here actually they're giving actual patients to examine, right? It's slit lamp only, right?
Yeah, yeah. And the worst part is
So,
the first patient examined, some person who was operating the slit lamp put the slit lamp into a +10 in the oculars.
oh,
I was looking at it, I could not focus at all. It gave me a headache. And then I figured out that it was in +10. By the time I put it back to 0, that my time was up. So I just took a glance and I walked out. I went to the next station. So yeah, look out for that also. And ensure that the oculars are properly aligned. IPD is correct before you examine the patient. You probably won't be given any grace time and all. Yeah, to answer your question, every patient, every station for me was a patient.
Raki, for 2024 batch, it was completely digital OSCE.
Yeah, because last series on retina also they were telling they didn't have any real patient to examine. It was all images and videos only.
I think it depends on the center.
Yeah,
So,
center.
yeah.
That is
And
what I
the-
wanted to tell you, that this depends entirely on the center. So back in the day when I went to first, like I said, so I gave my theory in 2012, and I think there were 30 or 40 of us who gave the theory, and I was the only one who passed. And when I went for the Viva and OSCE, it was at Calcutta. There they did not have patient, or those days no digital also. They had printed out pictures on A4 sheets, and they were of such poor quality that you could not make out anything. And I was the only cataract candidate. And the one picture was of a Sommering's ring with a opacified IOL. Now the picture quality was so bad that I thought that it was a cataract, a subluxated cataract. So on that basis, I didn't clear that time. But the next, my next center was in Delhi. It was at Gangara. And there it was like a proper OSCE, having proper patients and proper instrument stations and everything. So then it was much more. So I would suggest that all of you, have an idea where the center is and ask what is the kind of, OSCE stations they are putting up. So that will, I think, make a difference. It's not necessary that you always will get live patients.
Okay. So, ma'am, do you remember anything different from the ones that have been discussed here in the practical exam during your time, other than this?
One thing I found was very useful is like what he said, research the center where you're going, because they invariably ask questions related to, I'll not name the person, but one of the questions was there was a set of instruments there, and he said, one of the examiners, there were 3 examiners, has invented one of these instruments. There were multiple forceps and things like that. I had absolutely no idea what this guy's name is. Forget his. I mean, you don't know all the examiners. Okay, well, big stalwarts are there. Okay, you will know. So that is also very important. Know who are the names of these people who are coming as examiners, because everybody has a little bit of ego and they will like that their whatever invention or this thing is identifiable and people know about it.
So, Dr. Aditya, can you recollect any of your questions and which was your center, sir?
My practical center was at RP Center, Delhi. So as ma'am and Dr. Aditya also said, I had some idea, when I'm going to AIMS, I'll be having questions on some specific topics. That's what I had in my mind. So I thought of especially flags and all, we don't have at our center. But then I thought I will read about those things, some images which are not available with me, but on Google platform, we will get the images. So because specifically I remember some of the images will be very cropped. The questions, no, the OSCE which we had was we were sitting on a table and the questions were projected. As told earlier, we didn't have direct patients to examine. The questions were projected on the screen, and we were given a time of, I think, 1.5 minutes per question, and every question had multiple sub questions. So there will be some images, some instruments, some printouts of the investigations. So we should know where we are going, and accordingly we can plan what instruments usually they have, what type of machines they have. So so that will give us clue that what instrument or machine it is. Like the cropped image was of the flags, actually the docking one. And I really couldn't get it. It was something like a glowing thing, and I couldn't find out what it was. Probably the subsequent questions, the sub questions gave me the clue actually what it could be. they asked what platform it is, something like that was a question asked, and that gave me the idea like what it could be. And what I would say is we had almost like 10 questions, and everything about subluxated cataracts was one of the questions. Then about the syndromes also we had, like spherophakia, Marfan were the common ones. Then there was something about the IOL master printout also, where they asked about the toric marking and even the post-op, how to find out toric position, whether IOL is well in place, which are the options we can identify. So some of these were the questions asked. Some instruments were also asked. There were images shown of the instruments. So some were very simple, like a Simcoe cannula also, but then they will be having sub questions. So each question, if we answer correctly, only we can score the marks, obviously. And for the Viva OC as such, we did not have separate table exams. We only had one, and all the 4 examiners together, they had asked the questions. And they usually asked about the basic practical point of view also, like whatever we do day to day in our surgeries, like rigid pupils, then iris related complications, then DMDs, all those were few of the questions which were asked to me. And about the IOLs also, they had particularly asked about the specific properties of the IOLs, like yellow, why the yellow tinge is there, whether that will create any difference in the color perception to the patient, then EDOFs. So all those things were asked to me also.
Thank you, sir. Thanks a lot. So, what about the others? For you also, all the 4 examiners were sitting together, or you had to go to separate stations for each of the examiner for Viva?
We had separate stations. So
We also separate, Raki.
Yeah.
24 batch also was separate.
I think one person for instruments, one person for medications, one for investigations, to split up like that.
Okay.
So there's just one point I would like to add. Other than doing the research for the institute where you go for the exam, what I was asked is the institute where I belong to, they wanted to know what kind of machines we had. So they also want to know what kind of settings you have while you operate. That also they will ask you questions regarding that also. What are your own settings? Why do you use it? Why do you keep them? When do you want to change your settings, for the FAICO surgeries? Also, whatever biometers, for example, Narayana Netral has n number of biometers. So they would want to know what all properties they have. If you utter the word, you should know about the biometers, the mechanism, what they're particularly useful for. For example, one of the panelists mentioned about Argos, right? So it's pretty new, and it is one of the biometers which has a property of deeper penetration into denser cataracts. That is one of the reasons why that biometer is preferred over IOL master these days. So whatever new machines are there in the market, be it for flags, be it the lenses, catalysts, be it the biometers, to be up to date about it. And you should know, if you're uttering that thing, you should know whichever machines you're using and how they work. So that is one thing. Another thing is, I think for instruments and drugs especially, there's a very simple book which few of us must have used during our PG days, Lens and Cataract ka Khurana. Even that book is in a simpler language and it really helps. It helped me. So I think for the people who just want to start reading, they can start with the Lens and Cataract Khurana.
Thanks a lot. Dr. Veena, anything to add from your practical exam experience?
Actually, myself and Aditya did our exam at the same center. So whatever he has already covered almost everything. And all these things were asked. Whatever he said, we had cases also, and then Oski was also there.
Finally, one question I would like to ask to Dr. Shalu and also Dr. Prasanna. So, what do you think? What was the difference? What helped you to bag the gold medal? Something different from all the other participants for this exam?
Failures.
Yeah, I just want to clarify one thing. I think it's Dr. Prasanna who has bagged the gold medal. It's not me. So
Oh, sorry. I thought you bagged it this year. Okay.
No.
Oh, that's what Raki told. No, okay.
I was checking.
Okay, anyway, so to be very honest, Raki, I was getting too obsessed with the exams. I still remember vividly in 2021 October, I went. I knew the paper is going to flunk, so I sat, I read the theory questions, I memorized the theory questions, and I came out of the exam hall. Second time I went, again I did the same. So, I mean, just a old proverb only. I think try again. Maybe the gold medal was introduced actually from the Kolkata AOS conference, if I'm not wrong. I don't think they had it in Cochin. So it is just for the last 2 years that the medal has been introduced. So we just keep trying again. And I felt I was a better glaucoma person when I attempted on 2021 and 2022. So I really matured well as a better FAICO person only in 2023 and 2024. So I feel I did more varieties, hooks, capsular hooks, CTS, even doing vitrectomy in pars plana route after one of the webinars from David Chang sir. So I felt I did it much better later. The surgeries or even the whole concept of cataract, even eye trace, though I have not used, as Aditya beautifully told, I read a lot of those manuals and other things. So I felt I was in a much better position in 2024. That's why
You tell that the Viva is the one that actually helped you to score, right?
yes,
So the
yes.
theory
Viva
will
only
be clear
decides
to
it.
everybody.
Theory
Even
will be more
Kowski
or
will
less
be
same.
similar.
People will be more or less same. So once I remember Praful Maharana sir was my examiner. He just got me the iris, the capsular hooks. So when I saw it itself, I knew I was there when I did it. So it was like a slumdog millionaire for me because another examining center, they had a bleb case and it was a phakic patient with the bleb. Now how will you go and do the cataract? So I felt it was aligned. That's why it happened. I felt all the 34 candidates were good, but certain times it happens.
I would like to add one thing. In OSCE, we had as he said, Aditya said, we had so many abro questions for OSCE. For cases, we had some basic questions like LOCS classification. Actually, I was not. In our institution, we don't write grade cataract based on LOCS classification, and I have never given much importance to that. But luckily, I had just gone through that because my one of my friend, just before entering the hall, she was going through this LOCS classification, and just because of curiosity, I asked her to tell me also how it is graded. And one of the question was a cataract and to grade it according to LOCS classification. So such questions may also be asked. And in this OSCE, we had some anterior segment OCT pictures, like DM detachment, 2-3 questions were there. DM detachment and iris fixated IOL also, one anterior segment OCT picture was there. So such questions will also be asked.
So anything more to add from anyone else? So I think Aparna, Dr. Aparna, any doubts you have, anything more to ask?
Nothing, ma'am.
So I think with this we have come to the end of this session. We are almost on time itself. So I'm really grateful to the speakers here for their dedicated time and for their effort in making such great presentation covering almost everything, and to the panelists for sharing their insights and recalling their past experiences and sharing all the valuable tips with the audience here. I think this webinar will be greatly beneficial to all those who are planning or currently going to give the FAICO cataract exam. And I would like to thank ASOS office bearers once again and YOSI governing council members for their steadfast support to us for giving us all technical help regarding this webinar. Boston sir for his unconditional support throughout all the webinars from Young Ophthalmology Group and for organizing all these webinars. So now we'd like to conclude, and I hope everybody who has spent this precious time, precious evening time with us will be very happy that they have gained much tips and knowledge on how to prepare for this exam. With this, we can conclude. And thanks once again to all of you for sharing your time with us.
Thank you so much,
Kathy.
Dr.
Thank you.
Rani, for the opportunity. Thank you.
To all the panelists, thank you.
Thanks.
Right, everybody. Bye.
Thank you, ma'am.